Hello everyone, I am doing a little series of Ask ChatGPT your plastic surgery questions. So what I did today was I asked ChatGPT what are the most important questions a patient should ask before having facelift surgery. I've been doing this for 15 years. I think we do a good job with answering all the patient's questions or the FAQs, but I've asked ChatGPT what are the most important questions and they come up with a list of 20 questions. So I am going to go over them one by one and we'll do a little series and hopefully you will all find this helpful. The first question is, question to ask your surgeon is, are you board certified? So yes, I am board certified in otolaryngology, head and neck surgery, so I'm a head and neck surgeon, and I am also subspecialized in facial plastic surgery, so I have 2 board certifications. How much experience do you have performing facelift procedures? Well, this is all I do. I don't do anything else. So this is another excellent question to ask your surgeon. If you look at my profile, look at my feed, look at my reviews, look at my before and afters, they are basically all facelift patients. And I think the most important thing also, if you see me over the last 10 years, you'll see all my patients, all my posts are all facelift surgery patients. How much experience? So we perform a couple hundred or a few hundred every year. There are some years we do more than 300, some years we do about 200, so I've done thousands of these procedures. What are the potential risks and complications associated with a facelift? I explain to my patients there are 4 main risks with every surgery, not just facelift surgery, and all the risks that we explain are basically an offshoot of one of these 4. We say bleeding, infection, scarring, and nerve damage. Bleeding is always a risk whenever we make an incision on a patient, so there are things that patients can do before and after surgery to minimize those risks, and part of that is avoiding medications such as aspirin or Motrin or Advil, certain vitamins like fish oil, avoiding alcohol a week before and a week after surgery. All those things can minimize your bleeding. There's a risk of infection, which is why we have a protocol. We have our patients follow up before surgery, and my nurses will explain that. We'll also give you antibiotics for after surgery, and we keep a sterile field in surgery. There's a risk of scarring, which is rare, but it's always potentially there. Now, scarring for you may mean something different than scarring for me, but whenever we make an incision, you're always going to have a thin line wherever we make that incision, and my job as a plastic surgeon is to minimize those, the appearance of the scars. And there's also a risk of nerve damage, and there's 2 kinds of nerve damage. There's nerve damage where you have loss of feeling, where if I touch your side of your face, you can't feel it, or the top of the ear, you can't feel it. And there's also nerve damage where you can't move parts of your face, because the facial nerve is a nerve that we see during surgery, and we avoid damaging it during surgery. So all of those are potential risks during facelift surgery.